So it has been our top story over the last couple of days, the growing measles outbreak spreading in our state. Earlier, John was here. He was updating us saying that we're now at 36 cases. But as this spreads, we do have a lot of questions. We want to get some more answers. That's why we brought Dr. Elizabeth Mead, pediatrician from Swedish Medical Center, in this morning. Dr. Mead, thank you very much for being here this morning. Such an important topic.
Absolutely.
I think a lot of parents are concerned about this.
Yeah, I'm getting tons of questions, even in the hospital.
So what are some of the big questions that you're
I
getting?
think people want to know, is my child protected? I've had several parents actually who have said, we haven't vaccinated our kids, but we really want to get MMR now that this is an issue. So I think there's lots of swirling questions people are having.
Okay, let's get to those questions. Let's start, though, with the big story this morning. There's this lawmaker out there who's proposing that we basically reduce the number of exemptions that kids can get or that parents can get for their kids. Do you think that idea is a good idea?
I think without commenting on the bill specifically, because I haven't read it yet, I think that the community, the medical community, and really our state community is just interested in ways that we can improve our community immunity and prevent these sorts of outbreaks from happening. My personal feeling is that the absolute best place to start is just having an open discussion with your child's doctor and having a doctor who's willing to listen and have those conversations and answer questions and address any fears that parents may have.
And have those conversations based in science.
Based in science and based in fact. There's so much misinformation out there, but I think if you find a doctor that you really can trust and that you believe in, those conversations actually go much better than you might think.
So let's talk about, are my kids at risk here if they've been vaccinated?
Yeah, so the great thing about the measles vaccine is that it is wildly effective. So if you've had 2 doses, and usually the first dose is around a year, and then there's a booster a few years later, it's 97% effective at preventing measles. So for the vast majority of people who have been vaccinated, you're protected if you've had 2 doses.
So we're getting to the number 40 mark when it comes to people who've been impacted by this. The governor has declared a state of emergency. What stops this outbreak at this moment?
Yeah, so I think that making sure people are vaccinated, and the biggest thing for the outbreak is making sure that people who potentially have measles or who have a clear exposure do not go into public places. The thing that's really tough about measles is that it is so highly contagious. So if I have measles and I cough and you come in the room 2 hours later, you can get it.
2 hours later?
It does not have to be close contact, and that's why it spreads like wildfire.
That's crazy to think about. So, I mean, how big do you think this could get at the point? I mean, we're at 40. Could it get much larger than this?
There's a lot of potential, absolutely. I mean, I don't think we've seen the last of it. I think there will be more cases, most likely. The real danger is that when we get below that kind of community immunity level, and usually we say that's around 90% vaccinated, some people say 95%, it can just spread so quickly. And so in this outbreak that we're seeing in Clallam County, the vast majority of those patients are children, and children who were not vaccinated for measles.
So let's talk about some of the ways that, aside from getting vaccinated, that all of us can help here. You mentioned it, that it's so contagious. So what do we do?
So I think if you think you've been exposed, or if you think you might have measles, and we can talk about some of the symptoms and signs, don't go anywhere. Call your doctor. Find out how you can get tested in a way that doesn't expose a lot of other people. I've gotten calls from emergency rooms in the last few days saying, I think this kid has measles, and really they have baby acne and a fever, but I think people are so aware of it that they're just highlighting any potential cases, and we want them to do that. So if you think you've been exposed or you think you have it, it's really important to check with your doctor and get tested.
So give us some of the signs.
Yeah, so usually, and this is the hard thing about measles too, is that before you develop that classic rash, you're contagious for several days. So it often will just start with kind of fever, cough, maybe some stuffy nose. Eventually you may notice some white spots in your mouth, and then that classic rash starts, and it kind of starts on the face and spreads downward. But for about 4 days before the rash, you can spread it to other people. So it can be very challenging to know if you've got measles or you just have the flu or a cold.
Don't chance it, I would think.
Don't chance it. And I think, again, if you even think that you've been exposed, check with your doctor to see if you can get tested and if there's anything you need to do about it.
I think we're probably going to need to bring you back on this subject as this continues to develop. So thank you very much for being here this morning, Dr. Mead.
You're welcome.